Live. We are live now.
Hello.
Hi, everyone.
Hello. Hello.
We're still
Hello,
waiting
Waiting
for
for
our audience to join.
eyeballs.
Yep.
So today we are
If
in
you are-
all white colors.
Ta-da! So if you are here already, remember to comment a +1, give us a thumbs up, give us a hug. Give us a hug.
Yep, and help us to share out the video.
Hello, hello.
Hello, everyone. Thanks for joining us. Thanks for joining Beneficial. So today we're going to talk about inflammation and how SOLUMERIC and physio can
SOLUMERIC.
help. SOLUMERIC.
Yeah.
So how SOLUMERIC and physiotherapy can help with inflammatory diseases. Okay. So
Yep.
so lucky today again for Mr. Ben, founder of Ben Physio, to talk about this with us. Okay.
So I guess everyone start to feel boring already. Never mind. Next Monday we're going to change speaker. Next Monday we're going to speaker. Yeah. Okay. Next Monday I resign. Ben Lu resign.
Oh no.
Speaker. We change
dear.
speaker.
Uh-oh.
Okay. So what I call is preview. Next Monday, next new speaker will come in to tell you more. Okay. Stay tuned.
Stay tuned.
Yeah.
Yep. So everyone been waiting already. So what's the rewards for today's live? So there will be so today alternate will be giving out 3 SOLUMERIC. Okay. To 3 lucky winners. Okay. So again, what you can do is tag your friends, and then we will ask questions. Okay. So stay tuned in our live. And you are here already watching us, please give us a +1 or love shake. Help us to like,
Yep.
help us to share.
Yep, let us know that you are here.
Yep.
Hey, sorry, Ken, I think someone's phone is there. Is it? There's an echo. I think you have to mute.
Mute already.
Okay. Mute already, yeah. Okay.
Yeah.
Shall we?
Okay.
Let's go.
Yes.
Okay, Ken, show way.
Okay.
Yep. Okay, Ken, show way. Let's go.
All right. So before we begin with today's topic, first of all, I think we would like to just give some appreciation and gratitude to our frontliners for all their hard work in safeguarding our defense system, making sure that we are safe, we are healthy.
Yes.
Right.
Yes. So thanks to our frontliners against the COVID-19. But everyone knows in our body, right? We also have another defense system to protect ourselves from COVID-19. Okay. Yep. So we have a physical frontliners defends us from the COVID. Okay, which is our police. Okay, our soldiers, our doctors, nurses. We ourselves in our body, we also have a frontliners in our own body, which act as our defense system. Also, therefore, today our inflammatory. We are talking about inflammation because inflammation is one of our system. Next. Okay, so everyone, if look at this, the notes. Inflammation actually is a part of our defense system in our body. Okay. Okay, so if you look at the diagram on the left, right, so I kind of impressed with myself to get this diagram. So now from this diagram, you see 2 things. Okay, now number 1, maybe 3 . Number 1, helicopter. Okay, and number 2, the green color, which is our soldiers. Okay, now how this war battle, right, related to our inflammation. Now, inflammation actually is a process of immune system. Okay, when there is an antigen, that means what? When there is enemies come to our country, okay, come into our body. So our body will send soldiers. Our soldiers Our soldiers, okay, will be the one fighting against the enemies. Okay. Now, who sent the soldiers to the war zone? Is a helicopter. So here, helicopter is our blood. Here, helicopter is our blood. Okay, helicopter is mimic our blood. So blood vessel will transport soldiers, which is our white blood cells. Okay, neutrophils, blah blah blah, macrophage. Okay, to the inflammation area. Okay, to the inflammation area. So I purposely put this diagram to indicate how is inflammation. Okay, next. Okay, so one of the reason why we have inflammation is because COVID-19. Okay, now the very, very hot topic. Okay, when COVID-19 affect our body, okay, it also will trigger some inflammation in our body. Okay, not only in the lungs, also our heart. That's why the side effect of COVID-19 are partly pericarditis, some heart problems. Okay, next. 不行啊，这样我们 office 还是很大的 echo 不知道从哪里来。Okay, so this is the picture lah. So if you look at the first diagram on the left, when the sharp thing go into our skin, okay, that's where the inflammation start to trigger in our body. Okay, so and then the second picture, the blood start to, if you can see, right, the blood vessels slightly dilated. That means slightly mengembang, become bigger size. Okay, because soldiers are coming, they are transporting soldiers. All right, and then the third picture is all the soldiers going to attack that point. It's going to attack that point to heal the tissues, to fight the enemies. Okay, and lastly, when we success in this war, the wound will become smaller. So this is the whole inflammation in our own body. Okay, if you all remember, right, during my second life, right, I talk about bone spur. Correct or not? So when I talk about bone spur, what did I say? Congratulations, you have bone spurs, because it indicates that you are still living, you're still alive. So same thing, when you have inflammation, that means you're still alive. Okay, when you have no inflammation, bye-bye, sayonara. Okay?
That means our body is helping us in a way.
Yes.
Yeah.
Okay, yep. So, okay, next. Okay, so what happened to our body, okay, when there is an inflammation? So we call it pathophysiology. What are the changes? So as I said just now, we have more helicopters, right? More helicopters. So when you have more helicopters, your whole blood vessel become more dilated or mengembang. Okay, become dilated. Yeah. So to send more blood, white blood cell to come. Okay, red blood cell as well. So when it become dilated, right? Okay. Now number two, blood flow is increasing. The capillary permeability also increase. Okay. And number three is more white blood cells, neutrophils, the white blood cells. The soldiers are coming, okay, to help to kill the animals, to kill the enemies, okay, kill the people. Yes. Okay. Yep.
Yeah. Actually, this slides is very well organized and a lot of info in that. So yeah, if you are interested, just comment the slides. Comment slide, we will send you those. And thank you.
Yeah, and
the slides.
Further, if you have any questions, just feel free to drop us a question.
Yep.
All right.
Okay, next. Okay, so now, okay, when these neutrophils comes, okay, anyway, it's part of the white blood cells comes, okay. So, but very soon, because neutrophil is a very short period of a short life, okay, white blood cell. So other longer life white blood cell will come, which is macrophages, lymphocytes, okay, will come to replace the short life neutrophils. Okay, now this is where the problems, and this is where our topic today. Inflammation, okay, and your acute inflammations, when you not leave it untreated too long, it will become chronic inflammation. All right, chronic inflammation. So the point number five is explaining how chronic inflammation evolved from a acute inflammation, because it involves a lot of processes. Okay, so next. So therefore, today we're going to share is there are two types of inflammation. Okay, number one, we call it acute inflammation, and number two, we call it chronic inflammation.
All right. Before that, Mr. Ben, can you elaborate a bit more about acute inflammation? Like what conditions are in acute inflammation?
Okay, so okay, we go to our first slide. Next slide, can or not? Okay. Now here we also stated that acute inflammation, or I call it short-term inflammation. Okay, means it's quite a short while, recently one. Okay, so it happens just very recent, and the tissue, that means the tissue damage due to some trauma biomicro invasion. That means a dog bites you ant bites you bees bites you okay, whatever. Okay, and it causes some inflammation. Okay, and it happens very fast. Imagine if your bees bite you, a snake bites you, the inflammation happens very fast, correct or not? Very fast. Within few seconds, if the snake very poison one, maybe within a few milliseconds start to have erection, something like this. Okay, so acute means it happens in a short time. Okay, and therefore it can also go off if you treated it well. Okay, now if this acute, if you leave it too long, what happens? It will turn into chronic. Okay, I give you an example. Okay, here we have few examples, right? Tennis elbow, golfer elbow, swimmer shoulder. So now this three is an acute pain that our body normally has. Okay. Okay, it still can get the echo, right?
Yeah, a little bit.
有很大。Okay, so if you tennis elbow, you leave it untreated, it will turn into chronic tennis elbow. That's why some people tennis elbow can last for 2 years, 1 year. All right, so swimmer's shoulder. Okay, if you leave it untreated, it also can turn into frozen shoulder. So therefore, in this here,
yeah.
Sorry.
No.
Okay. Also again, so acute inflammation, if you leave it too long, it will turn into chronic inflammation. All right. So again, if acute one, you treat it early, it will heal early.
Yep.
Okay. Yep.
Meaning the inflammation cycle still going on, helping our body to recover. But still the root problem is still there.
Yes. Okay. Now we have acute inflammation for carpal tunnel. Okay, carpal tunnel. This round is talk about the nerve. The nerve is the nerve. Okay, inside in the wrist. Okay, inflamed. Okay, again it's inflammation. Okay, or the Queen syndrome. The Queen syndrome. Another word we call it mother's hand. Okay, so I think this Sunday, right, is Mother's Day. So anyone's mothers have a mother's hand. Okay, you can also refer them for physio. Okay, yeah, my personal opinion, mother hand is very, very painful. Okay, treat it early. Okay, so that you don't have to treat it. I mean, you treat early so that it can go away. All right.
Yeah,
and
so
one more
it
is trigger finger.
Yeah.
It doesn't turn into chronic. Okay, then we have a trigger finger. Okay, next.
Also, I will feel.
Okay.
Common conditions.
Yes, few common condition, acute one. Okay, plantar fasciitis, metatarsal, all these at the feet, and also some people call it sacroiliac joint pain, SI joint pain, or swelling, or buttock pain. Yeah, all these is acute inflammation. Yep. Now again, if fast enough, it will turn it. Okay, that's why some people go into a. Okay, then now. So then we'll talk about chronic.
Yep.
Okay, chronic inflammation, we call it long-term inflammation, and it lasts very long there. Okay, and it can be up to several months or even several years. Okay, many years. Okay, for example, osteoarthritis. Yes. Okay, osteoarthritis. So osteoarthritis, everyone knows already, right? The knee, no more gel. The hip, no more gel. Okay, and then the bone kiss into each other. That's why you got the inflammation. Yeah. Okay, so this is a so-called osteoarthritis.
Mr. Ben, your
mention swimmer shoulder. If you never get it treated well. Oh, is it?
Yep, a bit like
Slightly.
Okay. Can you hear me,
Yep,
okay. Yeah. Okay, so your swimmer shoulder, if you don't treat it well, it will also turn into frozen shoulder. Yeah. Okay. Frozen shoulder. Again, swimmer shoulder, you may need few sessions, 1 or 2 weeks to get better. For okay, so we also talk about
I think it's raining, is it? So
Yeah, I think could be
sorry
due
for
to the
a
rain.
little bit technical problems.
this is a
Yeah.
yes. Okay, so we have rheumatoid arthritis. Okay, already one. Okay, no. Okay, rheumatoid arthritis. No, their fingers look the finger
Finger they will be like
jaw
a bit
tested by a blood test.
Yeah.
Oh yeah, yes, your fingers look like that, leh. Sure, your fingers look like that, leh.
Oh no.
but no pain lah, no pain.
Yet. So I think better get it checked. touch wood lah, touch wood.
Sometimes we call it crooked.
Then I want to win the SOLUMERIC.
Yeah, would be good also.
Yes. Okay, then we. Yes. Okay, those who always have a gout arthritis attack.
Oh, okay.
Okay, so it's ankylosing spondylitis. Okay, yeah, this is a spine inflammation which happens constantly. All right, now this kind of patients normally they very
I think because of the raining problem.
very deep overdosage. So I would.
Yeah.
Okay.
So
never mind. So never mind. It's okay. One on now.
Yep. And ankylosing spondylitis also one of them.
Yes. Okay, and lastly, we talk about it's a system problem. Some people with some immune system problem, skin inflammation. And then we have fibromyalgia, polymyalgia, SLE, systemic lupus, erythemas.
Yeah, so all of these are
too many things to do.
More on the systemic issues that SOLUMERIC will be able to help.
Yep, it's more like the autoimmune system, like by yourself.
This is when your own body attacks your own self. So you have to do something about it, better.
Never mind. Those two, because it's this slide shows is quite informative. You all can just comment slides. A lot of info is just inside.
Yep. So once again, just bear with us, okay? So the connection is a little bit laggy due to the rain, yeah.
I can hear the rain outside there. Whose area?
I think everyone's place is also raining.
Suddenly.
It's rain.
Heavy rain today, yeah.
Okay, so next one. Okay, next.
So how should the patient or how do we know that we are having this inflammation problem?
Okay, very good question actually. Yep. Very good question. Okay, ngang, nghe, ngang. Okay, in Cantonese, stick. Okay.
Like morning stiffness.
So like when you wake up in the morning, then you feel like, no oil, is it something like that?
Yes. Okay, like where.
That can like stiffness and red and swelling, bengkak, and then warm is there also.
Yes. Okay. And then some people morning wake up, right?
Yeah, especially in the morning, there's a lot of stiffness when they wake up. Yep. The finger can unable to open up.
Yes. Okay. Yep. Or some people also.
Maybe it could be. Is it also because there's when they're resting, sleeping,
a bit swollen right in their hands. They feel like they cannot make a full only wake up time. They feel a bit stiff to grab. Yeah, so tendon is it? Yeah, okay. So of course, as Shuhei said just now, long time no move or too much long rest, like now MCO. Yeah, all this also in lah. Feel a bit warm lah, feel a bit fever lah. Okay, so now I ask you back. Do you think fever is also?
I think fever also
part of the
inflammation.
Yes, okay, fever also part of inflammation. Yeah, so that's why I go back.
Let's go back.
Yeah, fever I think is one of the warning signs that
okay, to check. Yes, okay. So I mean, Ben Physio is open throughout this M4 first 0.5 or okay below 37.5. Okay, so that you don't have fever. If you have fever, we will reject you.
Yep. So Mr. Ben is saying that during this MCO, we are quite strict with the SOP as well. We will check the
outside
temperature, all that. Yep.
Yes. Okay. So. Yep. So, okay. Okay. So next topic is we are going to talk about
the management side of inflammations.
How to manage? Okay, from different profession and different perspective. Okay. We have a dietary
dietary supplements, which is our SOLUMERIC.
Yep. Which is how you wanna get SOLUMERIC today. Stay tuned until the end of today's live, all right?
Yep. No, soon. We will throw one question.
Soon. Yeah.
Very soon. Have lifestyle changes to overcome the inflammation, as everyone know, anti-inflammatory. All right, and then we have a stretching exercise.
Yep. So for this inflammation.
Okay, and yep.
Some management part, like
okay.
Prevention, all this, and also at the side, in other way, can go for dietary supplements. And for our part, it's more like prevention, maintenance.
I think some lifestyle changes would be good also to know how are these inflammatory, what is causing this inflammatory response in your body.
Yep. That's why proper education, proper guidelines to patient as well. Is our role. Yeah, it's quite important.
Yep. Okay. Some people say active lifestyle helps inflammation to reduce inflammation. Okay, this is, but if you have acute inflammation, too active lifestyle is no good. So if you have a chronic inflammation, that means it's all.
Yeah, because in acute, I think because it's the injured
all
part.
The while, suddenly you have a very
better don't actively.
Yes, you are right.
Yeah, I think as explained in our previous life. Yeah.
Yep. Yep. So Mr. Ben is referring active. Actually, it's quite good for a little bit active activity is quite good for chronic inflammation.
But if it's very, very acute, like what we said during the previous slide, if you baru kena, and then if you continue on with your active lifestyle, that might not be the best solution.
I think rest
then you manage to do.
quite important.
Yes,
yeah.
yes. And again, if you are still wondering if to use hot or cold, feel free to refer to our previous live video.
Yep. We talk about the ankle sprain one, right?
Yeah.
Okay. Never mind those who are watching. Actually, you can just comment slides. Okay, we will send out the slides. This is very well organized information slideshows.
Yeah.
And today we'll also be giving out three bottles of SOLUMERIC. Okay, it's sponsored by Alternate. So what you can do is tag 3 friends. They will be asking you questions. Okay, help us to share.
And stay tuned all the way until the end. Then we'll throw some questions and find out how you can win these 3 bottles of SOLUMERIC. All right.
Shall we go to next slide?
Okay, so before we proceed next slide, can I throw one question first?
Okay.
Yeah, sure.
Okay. So, the coming question is, there are 2 types of inflammation. Okay, name it. Okay, there are 2
types of inflammation. Okay, you just heard it previously. 2 types of inflammation. What is it? So before you send us the answer, remember to share our video, tag 3 friends, and then you give us the answer. All right.
Okay. So what is that? Acute, chronic,
and maybe.
Okay. So just bear with us a little bit. So sorry for this.
Yeah. So just some technical errors due to the rain. Yeah, I see some correct answers already coming up. But again, remember to tag 3 friends, okay, and share our video. If you are here, give us a like, give us some heart, okay. And thank you for bearing with us.
Yes, thank you so much. So thank you for understanding.
Yeah. So I think up to this point, it is quite clear that all this inflammatory system is good to protect us. But if too much also, I think we need something to help us.
Yep, too much inflammation might cause more damage to our cells as well. Especially those are autoimmune system, right? We talk about like it start to attack our own cells already.
Our own body system. Yeah.
Okay, shall we proceed? Next slide. Okay.
So how beneficial manage?
So basically, again, okay, we have science, we have biomechanics. Okay, we use science, we use biomechanics to analyze, okay, problem and what caused the problem. Okay, and then secondly, our strength, manual therapy. Okay, we use manual therapy. We have our own way, our properly and effectively can help to reduce acute inflammation. So a lot of people scared, hey, I guess. Okay, because it doesn't mean that you have pain, I cannot touch you. I still can touch you.
Yep, because we
have our
focus on assessment, proper assessment.
Yeah.
And we don't just treat the pain, but rather the root cause.
Yes, exactly. So once again, what Mr. Ben is saying is we use science, biomechanics, and also what we are proud of what we do, manual therapy in handling your condition. Okay.
And the main thing also being physio focus is we are very, very goal oriented. Yep. So we don't just treat your systematic.
Okay, come to the. Okay, so now come to our main character today. Our main character, our G-Gok today.
Who is that?
Can music.
SOLUMERIC.
Okay, SOLUMERIC. Oh, very soon, three of us.
Yeah, thank you, Alternate, for sponsoring us.
Yes. Okay, SOLUMERIC, if you all notice, right, it stands from two words, if you all know. Soluble, turmeric. Okay, it stands from two words. Yeah. Okay, so basically, I'm not selling SOLUMERIC here. Okay, but yes, you can through via us, you can get SOLUMERIC this product. Okay. Now SOLUMERIC is as a name, it's called soluble, and turmeric. Okay. Now, as everyone knows, right, curcumin, which is part of the which is soluble. All right. Therefore, this alternate company, okay, they come up with this
advanced technologies.
So yeah, what Ben was saying is curcumin is one of the
turmeric extract.
Turmeric, yes, in the turmeric, yeah.
Yep. And
which
usually,
is normally.
So and therefore.
Yeah. So usually turmeric is actually not water soluble one. So only alternate.
Yes.
Yep. Make it in 100% water soluble.
Yep.
Only 100% water soluble. So it absorbs in our body, in our blood system.
Much faster, much better, much more efficient.
Yes.
And turmeric is also the most
powerful
natural anti-inflammation and antioxidant agent. Yep. Mr. Ben say want to demo experiment.
Yeah.
No, not experiment. Okay, so now I have a SOLUMERIC with me. So I open. So there. Okay, this is SOLUMERIC. Okay, recognize the brand. Okay, recognize the name. It's already trademark. Yeah, it's a golden color. Okay, so now very easy. So what I need is I just need a glass of water. Okay, we have 200 ml of water. Okay, can see water. Water. So
Mr. Ben, maybe you show down your laptop. Can see clearly.
Laptop. Okay, can see. Okay, so I just need to have 3 drops. Oh, sorry. One. Wait now. Okay. Okay, 1 pump. Oops. Okay, 1 pump into the water. Okay. Yep. Okay, so 1 pump normally equals to 1 ml of this turmeric. Okay, it's an essence. So basically, your water will be into a little bit yellowish. All right, but actually, it's a tasteless one. Actually, this water can see. Now best. Okay. So actually, you can see, right, the SOLUMERIC actually dissolve into your water and our water. Okay. Yeah. So and that's where I just drink it. I cannot finish at 1 cup now.
Yum saying.
Nice, Mr. Ben.
Tasteless. Nice. Okay, actually, it's tasteless.
Just like plain water, is it?
A bit wasted at the bottom there. Yeah, just like plain water. A little bit. I mean, I think a little bit turmeric taste. Okay, so that's all. It's very easy. So whereby you just take out the whole thing. Yeah, this one need water already. Okay, so you just drop the one pump right into the water. Okay, to about 200 ml, and that's where you drink the water. All right, so we suggest is one okay for everyone. So for those who are chronic inflammation one, right, this is where your anti-inflammatory yeah. So thank you. So those with chronic inflammation one, this is where your anti-inflammatory come from. Okay, a very concentrated anti-inflammatory, high anti-inflammatory and high antioxidant. Okay, this is what we suggest or propose. Yep.
Yeah,
Okay.
Mr. Ben, can you rephrase again? How much which the patient should get?
Okay, one pump, because if
One pump only.
you come so it's which is equals to about 1 ml. Okay, and then drop into a 200 ml of water. Yes. Okay. If you need a little bit more precise all this in direction, right, you also can refer to their website. Okay, which we will give you all after this.
Yep.
Yeah. Okay. So again, thanks to Orthony. Okay, this SOLUMERIC is
thank you very much.
Orthony, which is an Australian healthcare company. Okay, they sponsor for this.
Yep.
Today is 3 lucky winners who can own this, who can bring this home.
3 lucky winners.
Yes.
Yep.
Okay.
Worth 118 for the
per bottle.
Okay.
Yes.
Yes.
Yep. 3 friends and answer the question.
Yes. Okay. So just a quick. Yep. And tag 3 friends. So just now we have a question number 1, right? Now we have a question number 2. Okay. So what is name today? Okay, start with S. Okay, what is our product names today?
What is our product name today?
Okay.
Not the company name, the product name.
Yes. Okay.
Remember, the clue has already been given.
Slide. Okay, so basically this SOLUMERIC, right, again, as everyone knows, it's a turmeric, okay, which is a gold-colored spice, okay, and it can help, okay, which is a lot related to pain, inflammation, okay, and the main essence is the curcumin, something called curcumin, okay, the biologically active compound in the turmeric. All right, curcumin is it's a little bit yellowish, like just now you saw in the glass. Okay, that's a color. All right, and curcumin is a very
it's a natural most
highly antioxidant. Introduce this Orthony turmeric. Yes, as an anti-inflammatory, because I always have a lot of patients come with a chronic, because it's a natural products. Okay, it's a vegetable source. Okay, it's very safe to use it long life.
Yep, and especially if, of course.
All right, because again, on anti-inflammatory.
Yep, and
but
also
if you have any queries.
Any queries, you can further.
Any queries, any question, can visit the website or contact the number provided, to ask about the product.
And one thing about why we trust this company so much, because it's a research-driven company. Their products all research-driven, and they also have a lot of testimonial. You can look at their website about how it helps, maybe for their inflammation, lung inflammation, COPD. You can look at their website. There are a lot of testimonials.
A lot of things you can learn from their website as well.
So, okay, next slide.
Our main.
So this is the turmeric. Yep, next.
Main component.
So this is our essence. Yep, the main component in the turmeric. Okay. Yep. Next. And again, So because it's a water soluble, so it makes the absorption is superb. Okay, for solumeric, it makes the absorption is superb. So if you go by the normal type of the turmeric one, normally less than 1%. Yes.
Less than 1%.
Okay, but because of this solumeric, yeah, it's a lot more higher. Okay.
I think for those that have turmeric powder at home, what you can try is just take a bit, maybe a small amount of turmeric and try and dissolve in water, see if it dissolves or not.
Should be no, because it's less than 1%.
Good experiment.
Yep.
Yeah, something good for you to try at home. Then you see if it's really blended in together with the water, or you can still see the powder in the water.
Okay, next. So these are the clinical studies, okay, about the curcumin's role. They review the curcumin, okay, as an anti-inflammatory. Okay, again, all these are the latest research, 2017, 2015. Okay, next slide. Okay, so the research, okay, these are a little bit old, 1980s, 1986. Okay, but they studied this curcumin on anti-rheumatoid for rheumatoid arthritis. Okay, and very significant result, with very significant result. Okay, next. Okay, so to your surprise, they also did this curcumin's effect on Alzheimer. Okay, they did the research on SLE, okay, systemic lupus erythemia. So like just now we were saying, Alzheimer, SLE, all this is a chronic inflammatory disease, which they highly and prolong depending on the anti-inflammation. So this is a good product for our patients as well as any other patient with SLE. If you are looking for some product which are anti-inflammatory and you want to take.
Yeah,
okay,
Mr. Ben, I think there's a question from someone. So if let's say they don't have any inflammatory condition, can they also take SOLUMERIC?
Okay, let's put it this way. Okay, inflammations happen every day, every part of our body. Okay, as long as we move, inflammations will happen. Okay, for example, I'm now just walking from my door to from my car to my door. The knee, I mean, any parts of the body, especially the lower legs, already will have some minor wear and tear. Okay, and all these wear and tear inflammations are so minor that we can omit it. All right, but it's happening. Okay, that's why we call wear and tear.
Yep, that means if there's inflammation, that means our body cells are all working.
Yes, you're right. Okay, so so we can take. Yes, okay. So if you have a minor cough, sinus, yes, that's also we can take. Yep.
Then I think there's another question over here. How soon do you see the result?
Okay, this is what we call it, a dietary supplement. All right. Now if you are having acute tennis elbow today, you are not relying on SOLUMERIC to treat your tennis elbow. All right, that's why just now we come back. Okay, we have a dietary, this one of it. Change your lifestyle. If you're a tennis elbow, that means what? You may need to stop or rest from your games. Okay, or your some activities that trigger it. How about physiotherapy? Yeah, so the effect does not come immediately because of you are taking SOLUMERIC. Okay, so over here we are telling you is that we are delivering the information or message. SOLUMERIC is one of the anti-inflammatory, high dosage anti-inflammatory that you can take for long period of time. Yeah. If you
so yeah, this is one of the supplements you can take.
Short, okay, for the first one.
Yep, as mentioned here. Also, you can take for joint, muscular pain, swelling, stiffness, nasal
congestion.
Sorry, I'm back. Okay.
Once again, thank you for bearing with us.
Thank you. Yep.
Okay. So yeah, these are the okay, basically SOLUMERIC is suitable for anyone actually. Joint, muscular pain, or even to have no pain. If you're healthy like me, I'm healthy today, I still can take, no issue. Curcumin, do you eat curry every day? You eat curry every day, right? In your curry got what? Curcumin, correct or not? Is that all? Okay, that's all. So nothing wrong if you can take, you want to take every day. Okay, because inflammation happens every day. Okay, every now and then. Okay, so and then yep, next one. So these are some advantages of this product. Okay, which again highly powerful anti-inflammatory antioxidant agent. All right, and then it's a 2 or 3 times more potent and more affordable than other turmeric extracts. This is an extractions. And okay, now come to the last one, right? Okay, no contraindication. Okay, but okay, I put but 3 buts, because very important. I have to say 3 times. Okay, if you are taking warfarin or anticoagulants medication, this is where you have to be careful, or you need to consult your doctor. Okay, yeah. So I put 3 buts already. So currently it's more suitable. Now some people may ask, hey, pregnant or post-pregnant, can I take? It depends. Okay, now there are some they say because there are some they say turmeric may make the baby more jaundice if you breastfeed the baby. Okay, so again, also all this you have to check with your gynae doctor or as well as your pediatrician. Okay, yep. Otherwise, normal people like you and me, yes, we can take. Okay, most important. Okay, again today, most important the message is this product you can take it for long term. Okay. You can take it for long term, and it won't give you adverse effect because it's an extract from a vegetable, or it's from our natural resources. Yeah. All right. Now to have more information right about this product, this is where you can get them. Okay. We have the address. We have
the address, the phone number, email. Yeah. Do visit their website as well.
Yeah, for more inquiries or you have something to ask.
Yes. Okay.
Okay, right. Mr. Ben. The third question.
Yes. Okay. I almost forgot about the third question.
Yeah.
Okay. Now, okay, but for inflammation, right? What are the managements that we can use for inflammation? Okay, just now we listed 5. Okay, so you just need to tell us one of it. Okay, so how to manage inflammations? Okay, we listed here 5. Okay, tell me more. Okay, so again, tag 3 friends and give us one answer, one correct answer. And today we have 3 winners. Right? We're going to have 3 winners.
Yep.
3 lucky winners. Yep.
Yes.
Yep. So just to repeat, the first question is, there's 2 types of inflammation.
Who?
So,
yes.
Acute?
Yes.
Only? Is it? Then tag 3 friends.
Maybe.
Let's answer the question.
Yeah.
And then the second question, what is it?
Second question.
It's
what is our product name?
Product name.
What is our product name today? Start from S. Start from S. Okay, and third question. Okay.
Third question.
So something.
So what is the
how to manage inflammation? Okay. Yep. So that's all, I guess.
Yeah, and once again, thanks for bearing with us. And just a reminder that next Monday we are having topics presented.
Next Monday, Ben resigned already.
Yeah.
New speaker coming.
New speaker.
Yep. So the topic actually talk about.
Yeah, we have new speaker.
Oh, jaw pain.
Yeah. So a lot of people doesn't know physio also can help with jaw pain. Yep. So how do you do self-examine?
Yes,
how do you do treatment for yourself?
To have
special.
Yep.
Yeah, specialize in that. Yep, someone.
We'll have someone to talk about it.
Special subject, special
Yeah, do stay tuned. It's very interesting topic.
Yeah.
Okay, same thing, Monday 4 o'clock. Okay.
Okay. Thanks to ladies and gentlemen. See you all on Monday again.
Thank you, Mr. Ben, for the sharing.
Bye-bye.
All right, see you all. Once again, thank you, everyone.
Thank you for joining us.